the forgotten mineral your body can't live without. Magnesium is involved in over 300 biochemical reactions in the human body, yet a large proportion of people are deficient without realizing it. It is estimated that up to 70% of people in North America are deficient in magnesium. Hi, I'm Dr. Jean-Pierre Kabongo, family physician, health advocate, and founder of movement HOMESTEADication. In my 2 decades of practice of family medicine, I have used magnesium in certain very serious and potentially life-threatening conditions like hypertension and seizures of pregnancy, heart arrhythmia, serious asthma, as either an adjunct treatment or the main treatment to save lives when I was working as an ER physician. Today we'll explore what magnesium is, why it matters, where to get it, and when magnesium itself becomes treatment. Without further delay, let's start. 1. What is magnesium? Magnesium is an essential mineral and electrolyte. Your body cannot synthesize it, so it must come from diet or supplementation. It is the 4th most abundant mineral in the body and the 2nd most abundant intracellular cation. Distribution: 60% in bones, 20% in muscles, the remainder in soft tissues and blood. Please note that serum magnesium often underestimates total body deficiency. I remember many years back how serum magnesium misled me in the diagnosis and management of one of my patients. Mrs. Ming, 56 years old. She came to see me for pain in the legs, especially in her right leg, sometimes very strong. All the investigations, including serum magnesium, came up normal. On weekend, while awaiting to have another test I had requested, and given that the pain medications I prescribed was not working, she ended up in the ER. Further investigations showed her magnesium deficiency. She was given IV magnesium and her pain was controlled almost instantly. 2. Role of magnesium in the body. Magnesium acts as a biological stabilizer. Key roles: regulates nerve excitability, maintains cardiac rhythm and vascular tone, enables muscle relaxation, activates ATP energy production, required for DNA, RNA, and protein synthesis, supports bone metabolism, modulates the stress response and sleep. Magnesium is therefore anti-excitatory, anti-inflammatory, and neuroprotective. 3. Risk factors for magnesium deficiency. Magnesium deficiency is frequently common in following conditions: ultra-processed diet, low intake of leafy greens, nuts, legumes, chronic stress, alcohol use, diuretics, proton pump inhibitor treatment like pantoprazole, esomeprazole, diabetes and insulin resistance, GI disorders, IBD, celiac, aging, excessive sweating or intense exercise. 4. Signs and symptoms of magnesium deficiency. If you are struggling with one or more of the following concerns, MG might be the missing piece of the puzzle. Please discuss with your doctor about. Common signs and symptoms of magnesium deficiencies are early fatigue, muscle twitching or cramps, headaches, anxiety, irritability, restless legs, advanced insomnia, palpitations, constipation, hypertension, hypokalemia or hypocalcemia. Severe deficiency can cause arrhythmias and seizures. 5. Ways to assess/test magnesium status in the body. There are many tests that can be ordered, but I will focus only on the 2 most used and their limitations. 1. Serum magnesium. Most common but least sensitive. It measures magnesium in the blood serum, which represents 1% of total body magnesium. Normal range (0.75, 0.95 mmol, 1.8, 2.3 mg/dl). Limitations: poor reflection of total body magnesium, can be normal despite significant intracellular deficiency. Homeostatic mechanisms keep serum levels stable until deficiency is severe. Clinical takeaway: a normal serum magnesium does not exclude deficiency. 2. Red blood cell (RBC) magnesium. It measures magnesium inside the red cells, which is a better reflection of intracellular magnesium status. Advantages: more sensitive than serum magnesium, correlates better with symptoms. Limitations: not widely available. Reference ranges vary by laboratory. Clinical takeaway: RBC magnesium is the preferred test when available for suspected chronic deficiency. 6. Clinical indications. In which circumstances should we take magnesium? Magnesium supplementation. Proven or suspected deficiency. Chronic stress or burnout. Muscle cramps or spasms. Migraine prevention. Sleep disorders. Insulin resistance. Long-term diuretic or PPI therapy. Fibromyalgia. Type 2 diabetes and metabolic syndrome. Acute asthma, IV magnesium. Magnesium may be adjunctive or first line, depending on the condition. For most common conditions, 200 to 500 milligrams taken once at night would be acceptable for most adults. Dose adjustment is required in kidney disease. Please discuss this with your doctor. However, the form of magnesium chosen is the most important step, so please choose wisely. 7. Different forms of magnesium used in therapeutics. Magnesium citrate has good absorption and osmotic laxative effect. Best for constipation or general use. Magnesium glycinate, bisglycinate, chelated, very bioavailable. Minimal GI side effects. Ideal for anxiety, sleep, muscle pain. Magnesium malate supports mitochondrial energy, useful in fatigue, fibromyalgia. Magnesium threonate crosses the blood-brain barrier. Used for cognition and memory. Magnesium oxide, poor absorption, mainly laxative, not ideal for deficiency correction. Magnesium sulfate, V or oral. Used for eclampsia, arrhythmias, acute asthma. 8. Sources of magnesium. Where can we get magnesium from so we can live healthier? Dietary sources is the best first line, as we believe in HOMESTEADication that food is our first medicine. Here are common sources of magnesium. Leafy greens, spinach, Swiss chard. Nuts and seeds, pumpkin seeds, almonds. Legumes, black beans, lentils. Whole grains. Dark chocolate, so 70%. Fatty fish. Avocado. Please note that soil depletion and food processing significantly reduce magnesium content in modern diets. This explains why deficiency is so common nowadays. 9. Diseases and conditions where magnesium is used as treatment. As advisors, I would advise you to supplement with magnesium if you are suffering from following conditions: migraines, hypertension, cardiac arrhythmias, preeclampsia, eclampsia, high blood pressure in pregnant women that can cause seizure, anxiety disorders, insomnia, fibromyalgia, type 2 diabetes and metabolic syndrome, asthma. 10. Conclusion. Magnesium is not just a supplement, it is a foundation mineral. It supports nervous system balance, cardiac stability, metabolic health, stress resilience, sleep and recovery. In a world of chronic stress and processed food, magnesium repletion is often therapeutic. Before adding more medications, sometimes the most powerful intervention is replacing what the body has quietly lost. If you have learned something after watching this video, make sure to subscribe and hit the bell so you do not miss such contents next time when they are released. Of someone struggling with constipation, migraines, elevated blood pressure, cramps in the legs, insomnia, restless legs. Please share this video with them. Thank you for watching.